Hello and welcome to The Print. I am Sumi Sukanya Datta and you are watching Health New. Hypertension remains a persistent health problem in India and is a root problem of most cardiovascular conditions, which are also the biggest killer in the country. Today is Hypertension Day, and to discuss everything around it, we have two very special guests with us, Dr. Ashok Seth and Dr. Vivekanand Jha. Dr. Ashok Seth is interventional cardiologist and chairman of Fortis Escorts Heart Institute, and Dr. Jha is executive director of the George Institute for Global Health and is known for work related to hypertension and kidney health. Welcome, Dr. Seth and Dr. Jha, to our show today.
Thank you.
Thank you. Thank you very much.
We all know that hypertension numbers have been increasing year on year in India, and from public health point of view, it has really been a big challenge for the country. So, what are the factors leading to it, Dr. Seth? Can you please start by answering this question?
Yes, of course. I think this is very important. And really, at this stage, nearly 25 to 30% of our adult population suffers from high blood pressure. And to understand that lifestyle, it is a lifestyle disorder. Lifestyle have changed immensely over the last 25 years, 20 years. And we now see obesity as a growing problem, increasing problem. In fact, obesity grew 200% in the last 10 years. We've seen that happen 5 times over the last 30 years. Obesity grew. Childhood obesity has grown. So that's an important factor. There's no question about it that diabetes has grown, and that's an important factor. Smoking is a very relevant factor, and there's lifestyle changes happening with increased smoking. Alcohol, excess of alcohol intake is one of the most important factors in recent times for high blood pressure. And of course, in addition to that, we understand stress as an important risk factor. Lack of exercise is an important risk factor. And can you believe it? Simple stuff like excess salt intake in our Indians, which is 3 times to 4 times more than the WHO standards and advice, is an important risk factor in Indians because we eat a lot of namkeen, we put extra salt in our food, and all this combined together, must tell you, results in high blood pressure, a growing problem to the extent that it's not just a growing problem in the adults, it's increased in the young for the same very reasons that I've discussed.
Yeah, the factors that you mentioned. Dr. Jha, we would like you to chip in at this point and tell us, while hypertension, like Dr. said, has been a big problem, we also know that untreated or under hypertension, which is not under control in India, is also a huge problem. So, what are the factors you think are responsible for that? Why is there a treatment gap?
Yeah, thank you, Sumi. Thank you for covering this very important topic. And Dr. Seth has very nicely set it up. And you raised something which is critical, that even when people know that they have hypertension, their blood pressures are still not controlled. And there are a number of reasons for that. One of the, of course, we are not talking about people who don't know they have hypertension. So these are individuals who know they have hypertension and maybe they have started some treatment. So one of the most important things is poor medication adherence. People don't consistently take medications. People forget. People feel that the regimens are complex. Fear of side effects, and most importantly, people believe that if they don't feel anything, they don't need to take the medicine, that they're totally unnecessary. People will come and tell us in our OPDs that I feel absolutely fine, and I will take the medicine only if I feel any symptom like I have headache or something. But there are other system level factors as well, which is high cost of medicines and out of pocket expenses, which force people to skip medicines. There are a large proportion of our population which have relatively limited access to healthcare. Essential medicines which are required for treatment of blood pressure, they are not available in our public health system, or even when they are available, they are not available consistently all the time. There is the issue of low awareness, low health literacy, etc. And even when people are taking medicines, because of a number of factors that Dr. Seth mentioned, for example, failure to reduce their salt intake, failure to improve their lifestyle, even blood pressure medicines don't work as well as they should, and therefore people remain still uncontrolled. The last point I would say is, even from the perspective of the practitioners, that people don't often know what is the optimal blood pressure level to which it should be brought down. And some of our colleagues are still stuck in the past, where a relatively higher than expected or desired blood pressure level are considered acceptable. So these are the reasons blood pressure still remains high despite people knowing that they have blood pressure and starting treatment at least.
Yeah, so you brought up a very important point about the BP readings or measurement and the evolution that it probably has seen. Dr. Seth, being a clinical clinician and who's been seeing patients in day in and out every day, could you please elaborate on what are the latest readings that one can look at what age is the appropriate BP that one can target to achieve? Can you
Yeah,
please talk a little
of
about that?
course, of course, and any age, by the way, every age needs to be normal. So I think this myth about, say, elderlies being allowed to have higher blood pressure is actually a myth. Yes, we don't want low blood pressures in the elderly, but they should not be allowed to go. So clearly, it has to be 120 over 80. And there's no question on that. In fact, our levels have gone lower and lower than the past, to be very strict about the fact that 130 to 130 over 90 for us gets a warning, and anything above 130 over 90 is high blood pressure. So ideal blood pressure 120 over 80, and by 120, even 130 is a high blood pressure. For mildly, it's a mild hypertension. So we need to be very, very particular. The reason for this being particular is it is actually one of the single most important factors for a lot of disease processes which exist in the community at the moment. If I was to say that coronary artery disease, the biggest killer, hypertension is one of the causes for that, strokes, atherosclerosis, aneurysms, kidney disease, failing kidneys, eyes, blindness, you name it, and high blood pressure will affect it. And that is the reason. And yes, it's not just the fact that what Dr. Jha mentioned about why the blood pressure is not controlled. It's because it's a silent killer. But can you believe that only 25% of the population has controlled blood pressure, 75 is uncontrolled? And even in the most educated class of people, fine, we may say that lower socioeconomic status people may not have the finances or may not get their blood pressure checked or may not understand the implications of high blood pressure. But I'm now talking about those who can afford treatment, those who understand blood pressure, and those who, and Dr. Jha meets regularly, even those, can you believe, are only 40% of these patients have controlled blood pressure, 60% don't have controlled blood pressure, and are therefore suffering from the effects of blood pressure day after day without knowing it till their kidney fails or they develop heart attacks or they develop a stroke. So we're living in myths, and this is not just for elderlies and not just, I'm talking about young generation where 25% are suffering from exactly the blood pressure as defined by us in the present terms. More
Those
than,
numbers are indeed scary, the least I can say about that. Yeah. So, we have been seeing these viral images all the time of people, young people who are supposedly healthy and all well, and they are just, collapsing one fine day.
right,
In the
right.
gym, at workplaces, in parties, everywhere it's happening.
Yeah.
So, what role, while we understand that is happening probably due to cardiac arrest, which is sometimes unexplainable, but would you say that it's also because of undiagnosed hypertension or other cardiovascular conditions in some cases? What could be the plausible reasons?
So I think while those images are very disturbing, what we see of a sudden collapse in a young adult or in younger part of life, we must understand that yes, the commonest cause of a cardiac arrest in a young adult, and when I talk about anybody who's 25, could be even 20 and above, and up to the 50 years of age, or even is the commonest cause is a heart attack, which presents as a cardiac arrest in 10% of the people. So, in fact, and one of the reasons for heart attack and coronary artery disease is high blood pressure. So, you're right in understanding that high blood pressure is one of the important causes of heart attacks and occasionally that cardiac arrest which may happen. And high blood pressure is rising in the young. So those visuals obviously are of younger people. That is why we're talking about it. Is coronary artery disease rising in the younger people? And yes, we know that at the ages of less than 50, 40, 25% of the heart attacks are happening in our country in ages less than 40. And by the way, 25% of the population of our youth, which is between 20 and 40, has high blood pressure. In fact, it has grown exponentially over the last 20, 25 years. Again, for the very reasons that we're talking about. Stress has played an important role in this. Lack of exercise and obesity has played an important role in this. Bad eating habits, smoking, and alcohol has played an important role in this. And overall, we very well know that food has become more salty, especially stored food, packed food, less of vegetables, less of fruits. I think
Ultra processed food.
alcohol has increased immensely, and social drinking is now uh, is excess social drinking rather than not even social drinking is considered normal.
Normal.
Uh, yeah, so I think we really are worried about our youth, and hypertension is going undiagnosed. So we write, yes, hypertension is contributing to bad coronary artery disease, bad vascular disease, and that is the cause of some of those cardiac arrests that we see happening in younger individuals. But this has been more so of the last, 10 to 20 years.
So one common thread that we have been hearing is also, it's linkage to COVID-19, but more on that a bit later. We would first like to complete the question that Dr. Jha was answering, and it was about the burden of hypertension in a young people, the society, and from public health perspective. If Dr. Jha, you can hear what I'm saying, please do talk a little about us.
Yes, indeed. Indeed, indeed. So, a younger an individual is when they develop hypertension, the longer they will be exposed to high blood pressure, and all their organ systems will be exposed. So, what it does is that it leads to hardening of blood vessels, it leads to increase in what we call dysfunction of the inner layer of the blood vessels. It leads to increase in the volume of heart muscles. It overloads the kidneys, it stresses the blood vessels of the eyes. So all of these stresses and strains are there for a much longer period of time in a relatively young individuals, and so they have a higher lifetime exposure and thereby increased risk of developing all of these complications which we have already discussed. uh, then the younger a blood pressure younger an individual is when they develop blood pressure, the earlier they will need treatment. They will start suffering complications, and thereby they may become limited in their ability to live a full productive normal life, which is important not only for an individual's personal growth, but also contribution to the social productivity, contribution to their families, and their ability to take care of their families as well. So all in all, the younger an individual is, the longer is the lifetime risk of that individual of developing all of the hypertension related complications and the adverse events, not only on the affected individual, but also the families and the societies. We often don't talk about the psychosocial impact of illnesses, which includes hypertension. So people, once they get to know that they have an illness, there is a stigma that goes with it. People are looked at somewhat differently. Any illness, whether it is hypertension or not, and in our societies, I think these are also considered important for a number of social kind of rituals that we don't need to necessarily go into.
One follow-up question related to this is coming to my mind is, what age is the age when we can say that now is there an age where we can say, it's okay, it's expected that you'll have hypertension now, but not at this age. This is too young. Do we have that age?
Well, no, as Dr. Ashok said earlier, that at no age is hypertension acceptable. We know that hypertension, the odds of development of hypertension increase as an individual ages. But
Okay.
no age is, offers full protection against hypertension, and no age gives anyone immunity from the adverse events of increased blood pressure.
Yeah, Dr. Said, would you like to add something to this question too in
No,
answer?
this is, I think, the emphasis of Dr. Jha is correct. We don't want to anybody to believe, but ye to hona hi tha. Yes, as age goes on, it's an aging of the arteries, and aging of the arteries all over the body will cause a raised blood pressure. In fact, it also becomes equally important, therefore, that everyone has a regular checkup and takes blood pressure seriously, because while you may say that age brings out blood pressure, but that is unacceptable for the body because it's going to harm the body at any age, and by the way, result in strokes and heart attacks and kidney failure, which are perhaps some of the worst consequences at any age. And that is why we say blood pressure is bad at any age and needs to be controlled at any age, even though as we grow older, higher blood pressure is expected but not acceptable. High
Yeah.
blood pressure can happen but is not
Yeah,
acceptable.
yeah. Can I add to this point
Yeah, yeah,
that
sure, sure.
there was there was a time when higher blood pressure was considered to be okay for older age, right? But over the last 10 years or so, new evidence has emerged, both from epidemiological studies in which large number of people are followed up over a period of time, but more importantly from randomized clinical trials in which people have brought down blood pressures in individuals, including even the elderly, and
Yep.
shown that those individuals in whom the blood pressures were brought down actually lived longer. They had lower risk of complications, most importantly, stroke, heart attacks, kidney failure, etc. So, based on this kind of solid evidence, the guidelines around the world have now changed, and they are recommending appropriate treatment of blood pressure at all age. And the blood pressure targets have also been brought down to lower than what was previously considered acceptable.
Yeah, so if I put it this way, it's absolutely possible at any age to keep hypertension at bay, and you can have a perfectly normal blood pressure. But probably it'll take harder for you to work at around it. You will have to make certain changes in your lifestyle, the way you live, the way you eat, the way you exercise, everything, right? Correct me if I'm wrong.
Sumi, I would just add that you see, medications are there. And as we had expressed earlier, yes, there's the lifestyle changes and then there's the medication. Now, and we don't say it's one or the either. We have to control blood pressure. It's the medicines control blood pressure in addition to lifestyle. Lifestyle alone may get it down by 10, 15 millimeters, which may not be adequate enough for
Okay,
the patient.
that's a very
And,
important point.
and therefore, we always say that for us, it's the target of the blood pressure, and we get it down by both methodologies. We may be able to lower the doses of medication if a patient gives up alcohol, gives up smoking, reduces his weight, exercises well, gets his salt low. We may be able to lower the doses of medication, but it is important to take medications as advised, and it is important not to believe that I will be able to control it only with lifestyle if your blood pressure is not controlled. And do not continue to neglect blood pressure, but continue to check it up regularly, keep it under control, and let the doctor decide. And of course, self monitoring is a very important factor in control of blood pressure. So we advise our patients learn to measure blood pressure accurately. And that's the most important factor. Yes, home blood pressure readings are very important for us. They are perhaps even more accurate than in clinic blood pressure, which we take because a patient can have high blood pressure when he comes to us. We call
Yeah.
it white coat hypertension, or he may have rushed to the OPD, or he felt he was getting late and he would be tense and anxious. He could just be disturbed. His home readings are accurate, but we then have a responsibility to teach him how to do blood pressure. He also has a responsibility to measure it correctly and accurately enough. If he gets involved in monitoring his blood pressure, believe you me, that has a bigger impact on the patient rather than saying, "Arey, ye sab to chalta hai. I feel fine and I've got nothing there and I don't have any symptom. So just let me continue to just manage myself without any drugs."
Yeah, the very
Can
important
I
points
just
there.
add
But
a
is
couple
there a,
of
yeah, please, please, sir, go ahead.
Yeah, can I just add a couple of points to that? I think
Mhm.
Dr. Seth makes a critical point about home blood pressure monitoring. And now we do ask all individuals with high blood pressure to get a home blood pressure monitor and monitor their blood pressure at home. So that's just to re-emphasize that point. But two other things. One is that often, no matter what illness it is, we think that treating an illness means only taking pills. That's not true. So the treatment starts before pills. So lifestyle changes, reduction in salt intake, regular exercise, increase intake of fruits and vegetables, optimization of body weight, etc. That's all part of treatment of hypertension. That's so, as Dr. Said, these are non-pharmacological treatments, but they're still treatments, and we shouldn't assume that that's not part of treatment of hypertension. That's number one. And number two, also for people to know that even if we take pills, if we don't adhere to these lifestyle measures, the effectiveness of pills will go down. For example, there are certain types of pills which reduce blood pressure, but if we don't reduce the dietary salt intake, then the effectiveness of those pills goes down. And similarly, if someone doesn't reduce their body weight and doesn't optimize it, they will need to take larger number of pills, and they may develop what we call resistant hypertension, which is even much more difficult to control. So the point is that the importance of these lifestyle measures and non-pharmacological treatments cannot be overemphasized.
Yeah, one quick follow up to this thing, because you mentioned about monitoring BP at home. Is there an age where you recommend that, now this is the time you should start monitoring? It can't be for children, for example, I assume. So, once you are an adult in your 20s at 30, what age is the right age to start monitoring your hypertension or your blood pressure, rather? Sorry. Yeah.
If I was, I'd answer that, but by saying that, no age, it's a BP, it's a blood
Mm-hmm.
pressure, which can be measured at any age. You're right, yes, we don't regularly measure it in children, but we occasionally miss illnesses, which could be very important. But if you
Okay.
were going to say, let's just be advising the public around what they need to do, certainly, by the age of 20, everybody should know their blood pressure, even by the age of 15. In adulthood, the moment it is in teens, at least a single check of a blood pressure is advisable to know that it is running at a normal. In fact, many disease processes, even in the children, are picked up on the basis of blood pressure suddenly being found to be high. So a single blood pressure reading is absolute must, whether it's a 10-year-old, whether it's a 15-year-old, whether it's a 20-year-old. But by the time we get to the teens and beyond, yearly BP checks are an important aspect. In fact, any opportunity to get a BP check would be fine to find it normal. And that I mean, you're suddenly at a doctor, why not get it checked? You're suddenly with your relative who's a doctor, why not get it checked? I'm saying 2 or 3 times a year won't make a difference if you find it normal. But if you find it abnormal, that's a very important aspect, because that's when it starts getting, be sure that it is really high. Wasn't it an incidental reading? Multiple checks in the right environment, checks in the hospital, checks at home, maybe going to a 24-hour BP ambulatory check. Because, like we said earlier, if we pick up a BP in a younger person, that was unexpected. That could have a secondary cause to it. Could that be a kidney problem which has caused it? Could that be a cardiovascular problem which can cause it? There are numerous secondary causes for high blood pressure which may happen in a younger individual, because, as we said, as you grow older, the high blood pressure is expected a problem which will happen according to age. But in younger, it could be as a result of numerous other issues, including hormonal issues. There are certain tumor disorders which can cause high blood pressure. Certainly, there are certain cardiovascular conditions which cause high blood pressure, and certainly kidney conditions, primary kidney conditions which cause high blood pressure. And therefore, we are therefore very particular about the fact, keep getting your blood pressure checked. And by the way, even more importantly, because high blood pressure is an important cause of coronary artery disease, and we as a nation are the heart attack capital of the world, we want all our young gen to know their risk factors. And what are the 3 risk factors which get unknown but can be easily picked up? One, high blood pressure, never felt but can be easily picked up. Second, diabetes, never felt but a blood test picks it up. And finally, raised cholesterol, never felt but gets picked up on a blood test. We have
Yeah.
to emphasize that our young gen needs to know the risk factors to prevent the catastrophic events which can happen to them from these 3 most vicious conditions, but not ever felt or not even
Yeah.
seriously
Silent,
treated.
silent killers are
Silent killers,
these.
as they
Yeah,
call them.
just just as a rule of thumb, I think 2 points. One is that, as a rule of thumb, again, there will be exceptions. Uh, if someone doesn't have any other issues, then starting to measure their blood pressure once you reach adulthood, which is age of 18 or 19. And if the blood pressure is normal, then get it rechecked once every 2 to 3 years. But if the blood pressure is increased, then of course go to a doctor, and the doctor will then help you decide what to do. And the second is, as Dr. Seth said, what we call any encounter with healthcare system. Let's say someone goes to a doctor if they have respiratory illness, for example, cough and cold.
Mm-hmm.
Get your blood pressure checked. That's called opportunistic screening, right? So these two, if we want to leave your viewers with a message, I think these are the two rules of thumb I will suggest.
Yeah, very important points there again. So, before we wrap up this discussion, I also wanted to understand a little about the new treatment options, if there are any. Because in for diabetes, for example, we have this new class of medicine which is making news all the time. Do we have also got some options, newer class of medicines, therapies, and other interventions that can probably help hypertension patients? Dr. Said, would you like to answer that?
Yeah. Well, in addition to new medications and more effective medications with lesser side effects, there are two aspects or three aspects which have been shown to be very beneficial, and I would say that firstly, compliance of these medications becomes very important. We've already emphasized the
Yes, yes.
non-pharmacological and other
Mhm.
lifestyle measures which have to come in. Very important. And by the way, let's not forget, I would also emphasize in them alcohol, often missed. Uh, People are uncontrolled hypertension. We're trying to control it. And then there are two other conditions which often go unnoticed. How much alcohol is a patient taking? Because that alcohol intake is a very important factor of having high blood pressure. And the second thing is a condition called obstructive sleep apnea. Often missed. It's a condition which is respiratory and leads to hypertension, but often missed even when we even are questioning the patient, or even the patient doesn't realize that it causes high blood pressure. But coming back to this, and I'll address the neotherapies. But even in drug therapies is this issue of combined pills, which
Yes.
increases compliance. And that's been well documented that if we combine medicines into a single pill, once the patient has achieved a control and we know what is the dosing and therefore the combination pill comes in, the compliance is better and the efficacy therefore is much better. So that's another aspect which in India we certainly uh, you know we try and promote once the patient's blood pressure is controlled. Finally, for uncontrolled hypertension is renal denervation therapy, a technique which is an interventional cardiologist domain, and we now do that in uncontrolled hypertension, where people are on 3 or 4 or 5 drugs and still not getting control, is to put catheters in a conscious patient into the kidney arteries and with radio frequency energy ablate the nerves around the kidney arteries, which therefore leads to a feedback mechanism to the brain and helps to decrease blood pressure and make it more controllable, should we say. It doesn't cure blood pressure. We need to understand blood
Mhm.
pressure cannot be cured. It can be better controlled. And that is why we never say get the medicines off or do this or do that. And we just say everything is important in blood pressure control, but we need blood pressure control. So renal denervation is something that we do, something that we actually help to treat uncontrolled hypertension, and has been a big innovation over the last 10 years, which went through trials, went through troughs and peaks, and then now has become an established form of therapy for uncontrolled and resistant hypertension, when, at least for us in India, when a person is on multiple drugs, while there are other indications for it in the West also, where sometimes people want to go off medicines and so on and so forth. But that's a more intricate issue.
Yeah.
Can I just add?
Very
I think
interesting. Very short.
the issue of single pill combinations is a very important one, and it's now being recommended by the WHO also as a first line therapy for treatment of hypertension. It is helpful in increasing compliance, which means that people are more likely to take their medications, but also reducing side effects because
Mhm.
we give relatively lower doses of individual drugs. That's number one. Number two, there are a number of new molecules which are targeting specific pathways I don't think individual names of those molecules are very important. Dr. Seth already mentioned about renal denervation. But most importantly, a very exciting advance is the appearance of new biological therapies, which are called small interfering RNAs. And those are the injections, subcutaneous injections that can be given every 3 to 6 months and help to control the blood pressure. So that is really extremely exciting. But I think that's very novel, and it's going to be extremely, extremely expensive. So perhaps not going to be available to most of the people in India or most of the common people in India. But progress
I
is being made.
Are these drugs already available in India, Dr. Seth? Or do we have these
The,
novel therapies,
the
biologic?
I'm not sure about the biological therapies. I'm sure it's just an investigational at the moment. Renal denervation, we introduced it into the country, and we do renal denervation, and that's another aspect of the techniques that we really take up for specifically for uncontrolled hypertension on 4 or 5 drug regime. And I think that becomes an extreme situation where really we get helpless in the choice of drugs. Patients may have side effects from one drug, and then we are transferring to another drug and increasing the doses. But we always concerned for the patient. So yes, as far as the RNA molecules are concerned, I'm sure that's investigational at the moment and certainly not available in our country. But it's also investigational and not available in the West. But all these are promising events for the future, which may help us to control blood pressure with lesser drugs, should we say, and lesser side effects through newer modalities of treatment.
And also because they would need to be taken only once in 3 or 6 months, as Dr. Jha was mentioning, probably, treatment adherence will also go up, which is a major, major problem when it comes to hypertension control.
Yeah.
So thank you so much, Dr. Seth and Dr. Jha, for this very insightful and useful conversation. I'm sure our viewers will immensely benefit from it. Really glad that both of you could take out time for this and join us for this conversation. Thank you so much, sir.
Thank you,
Thank you
Sumi.
very much for accepting us.
Control of blood pressure is in our hands,
Yeah,
and we need to
absolutely.
have it under control if we want to live longer. There's no question.
Yeah.